transplant surgeons in 2009 had a rudimentary grasp of FUE hair transplant technique. And this is exactly the time when we started FUE hair transplant surgery. Not only hair transplant surgery, we started training doctors in the nuances, in the finer points of FUE hair transplant. Our first FUE workshop was held in 2010, attended by about 110 doctors. And in 2011, we had 235 attendees from all over the world. In this video, you can see that at Darling Buds Clinic, we have been doing FUE hair transplant, advanced form of FUE hair transplant, the same technique which you see today in various clinics all over the world, and in the so-called most advanced workshops being run today in all corners of the world. In the timeline on this YouTube channel, you will find long time back we have uploaded one of the videos about this workshop, the first recorded workshop in the history of FUE hair transplant, which was attended by such a large amount of people as you can see in this video. So watch this video, and if you have any questions about FUE technique, FUE hair transplant surgery, let me know and I'll be happy to answer. Have a nice day.
Good morning. We start today's procedure. This is Dr. Khan, 40-year-old male, Norwood type 5 male pattern baldness. Already undergone 2 procedures of hair transplant. One is a punch procedure. You can see the punch marks here, the scars, punctate scars with large mini grafts and macro grafts as well. And he got this punch grafting done at Delhi somewhere in 1999. And after that, during his strip surgery at Hyderabad, he received how many grafts?
He said 2000.
2000 grafts. The doctor told him that he had received 2000 grafts. So you can see that the hairline is quite adequate, but there are 2 problems. The direction of the hair in some places is incorrect. There are a lot of pock marks, and there is still reddish coloration, scar marks here of grafting. Now we propose to not lower his hairline any bit. We will retain the same hairline. This is the temporal peak. This is the frontal hairline peak. His temporal peaks are fine, and if you calculate the distance from here, it's about falling to be 7.4 centimeters. So it's perfectly fine for us. So we mark his hairline. So it's perfectly fine. We will not alter his angles as well. His recessions will be 1 to 8.2 here and 8.2 here. So we'll go along his existing hairline, giving macro irregularities. This is his hairline which we propose. Do you want a peak or do you want it rounded, Dr. Khan? This is fine? I'll show you the mirror Mangao. So you can see the mirror, and then you can see whether it's fine with you. The existing hairline is fine, or you want to alter it a little bit. Yeah. So I'll show you pictures of his head. You have seen him yesterday during dinner time. So I propose to give him good density in the frontal tuft area, make the frontal hairline and the parting line, just turn around the side, and give him good density because he combs his hair from left to right. So what we are going to do is we are going to give high density in this area, and we've discussed with Dr. Khan we will not be adding any grafts here. We will only be adding about 2000 grafts in this area. Our best grafts will go into the frontal tuft area, and also high density in this area, so that when he brushes or combs his hair to the right, this density is carried to the other areas of the head. So we follow this 2 things. One is the pressure therapy, and one is ice to decrease the numbness and to decrease the stinging while giving the anesthesia. So Dr. Khan, just tell me if once this ice you cannot tolerate the cold. Okay, then we'll start. So this is the first injection. third injection. I hope you're comfortable, Dr. Khan. Hello, madam. This ring block, as I had already told, that it contains 10 ml of 2% xylocard and 10 ml of 0.25% bupivacaine. Praneet, मेरे को gloves देना दूसरे वाले. To these things, madam, and then we dilute it in 10 ml of saline, and to which we add 1 ml of 1 in 1000 epinephrine. We plan to harvest in his case 2000 grafts.
Hello, sir. Good morning, sir.
Good morning.
I am Dr. Hemant.
Yeah, doctor.
Sir, you use xylocard, sir, or xylocaine, sir?
I use for the ring block xylocard, 2% xylocard. It has doesn't have preservatives, so it is less chances of having a problem in while using xylocard.
Okay. So, xylocard and adrenaline also you will use, sir?
Yes, in the first mixture, the ring block mixture, I use 10 ml of 2% xylocard, 10 ml of 0.25% bupivacaine, which is diluted in 10 ml of saline, to which is added 1 ml of 1 in 1000 epinephrine.
Okay, sir. Thank you.
And that is what we are doing right now. I will just repeat it. Dr. Khan has type 5 Norwood scale male pattern baldness. He has already undergone 2 procedures, one in 1999, which was a punch procedure, and we'll run the recording again and show you the close-ups. He has a multiple punch graft, about 50 punch grafts behind the scars, and in September last year he underwent a strip procedure. 2000 grafts were used. Though hair have grown, there is very little density. The definition of the hairline is not to his entire satisfaction, and as well as in the parting line on the left side, he wants more grafts to be added because his parting line also is not well defined. So we proceed to make his frontal hairline. We will not lower the hairline, not alter it any bit, just add density there and add density in his left parting line. Rest of the head we will not touch because we have limited grafts available, and we have to optimally utilize whatever is available to us today.
That scar is of the...
Madam, one scar is of the punch procedure. 50 punch grafts were taken from here. The other is a linear scar from ear to ear of strip surgery done 9 months back.
And
These went in the crown area, I think. Yeah.
Coffee sparse.
Coffee, yeah, sparse. Dr. Khan, you comfortable?
Yeah.
We monitor the patient's vitals on a pulse oximeter. No, madam, we are not taking any strip, we are not doing anything. We are just going to take from this marked out area, avoiding these punches. We will be harvesting FUE grafts only. We are not doing any strip method or any camo.
This was enough for.
For 2000 grafts,
Okay.
it should be enough. It would be enough. So we have drawn this line, you can see, along the tragus. We do not go anterior to this because this is in the balding zone. Because this is till where the temporal recession can occur.
I'm Dr. Swapnil Shah. I'm from Sholapur, Maharashtra. I was amazed to see the work of Dr. Bhatti. He's an amazing surgeon, and this conference has taught me a lot. And I'm all motivated to start my FUE practice. I'm very much interested in hair transplantation before, but I'm a dermatologist by profession, so maintaining the team for strip harvest and doing an extensive surgical thing is very difficult for me. By seeing Dr. Bhatti, I was amazed to see the speed at which he do the surgery, and he has made it very simple. It seems to be very simple, but I need to expertise. I'm really thankful to Dr. Bhatti for organizing such a nice conference. Thank you very much.
I am Dr. BSP Sinha from Jamshedpur. It was really a very informative conference for all of us, and we have learned all the basics and intricacies of the FUE hair transplant, and I think this will be very helpful in future for starting my own practice. Thank you.
Dr. Ajimon from Jalandhar. Coming to this conference was eye-opening. It was such an advanced technique of FUE under the guidance and expertise of Dr. Bhatti, which has taught us a number of tricks and the practical tips which will make us take up this course under his guidance.
Well, it was a wonderful experience today. I'm Rajiv Sharma, CEO of MedTech Incorporate, which is one of the largest suppliers of hair transplant equipment with a concerted focus on FUE. To be part of this conference was not only a wonderful experience, but I was very felt honored for being part of it and to meet so many doctors from faraway places, not only from India, but faraway countries like Kazakhstan also delegates were there. And I'll say not most of them, but everybody and all of them went satisfied, happy, and they think now they are better placed either to start their practice in FUE, and they can do better now in the field of hair transplant. And for me personally also, it was a rich experience. I have learned few more techniques how to go about in FUE, and this is going to do, I think, good for me as an individual. So as I can part with my knowledge, whatever I have acquired in this conference, to other surgeons and physicians who want to do FUE, but definitely it will also help me financially because I will be selling more and more to all of them. Thank you very much.
Girish, transcription from Bangalore. This is the first time I was observing this FUE technique, and I learned almost A to Z, at least the theoretical part about the FUE. Sir has informed us in detail about the FUE techniques, and we could always some good grafts as well. And we are very thankful to him for organizing such an event, which was so useful and informative to us. Thank you, sir.
Hello, I'm Dr. Paragno at Dr. Bhatti's Center for FUE Training Workshop. I'm very glad this is a technique which I think I can put into my practice right away, since I'm already doing the straight methods. And I am very thankful for the FUECON which has happened this time, because I've come almost 2000 kilometers for this, and it has helped me greatly in my theoretical as well as I think it will be applicable in my private practice.
Good evening everyone, myself Priyanka Verma, the staff member in this center, the Darling Birds. Firstly, my dad had come in this center, they had to do this hair transplant, and then he said this hair transplant career is the best option, and even I just consult the Mandy ma'am, she just consult me about this hair transplant and even I was just thinking like this course is very difficult and it is a very technical line, and even I am just I like the technical most. So after that it's my about 1 month I just came here, and I just there were the 3 days workshop, and I just learned all the things, all the instruments, how the ceramic slates, how the slime bottles and the ringer lactates and all. I just learned all the instruments about that. Even the Rajiv sir had just learned all how to use his instruments and all. Even it's the best career, it's the best moment in my life. I just want to say thanks to Dr. Bhatti that he gave me a very good opportunity for joining this. Thank you.
Dr. Pradeep Kumari from Pune, and the conference was very nicely organized. The participation was good, and the participants were very happy with the hands-on experience given.
Hi, I'm Dr. Ambika from New Delhi. I think the conference was very interactive and very informative, and for the beginners it was an excellent conference. Thank you.
हेलो, मैं डॉक्टर नितिन जैन हूँ पूना से. मैं previously I am doing the FUT technique. Today we have attended the FUECON and we are influenced with the technique. So we have purchased the Harris system, and we are certainly going ahead with the FUE technique also. So मुझे लगता है कि for beginners and as well as for the new era or coming up demand from the patient, we should start up FUE so that we can deliver more to the patient. You can combine or you can also do independent technique of FUE, and as per FUECON, for the FUECON I can say that we have seen live demos, and as well as we have got hands-on experience. So it is very nice and very well organized conference, and in next couple of weeks only, that much easy or that much means if you are a knowledgeable person with the hair anatomy and little bit of hair transplant, you can certainly jump into the hair transplant with the FUE technique. That's it, I can say. Okay, thank you.
I'm Dr. Swapnil Shah. I'm from Sholapur, Maharashtra. I was amazed to see the work of Dr. Bhatti. He's an amazing surgeon, and this conference has taught me a lot, and I'm all motivated to start my FUE practice. I'm very much interested in hair transplantation before, but I'm a dermatologist by profession, so maintaining the team for stiff harvest and doing an expensive surgical thing is very difficult for me. By seeing Dr. Bhatti, I was amazed to see the speed at which he do the surgery, and he has made it very simple. It seems to be very simple, but I need to expertise. I am really thankful to Dr. Bhatti for organizing such a nice conference. Thank you very much.
I am Dr. VSP Sinha from Jamshedpur. It was really very informative conference for all of us, and we have learned all the basics and intricacies of the FUE hair transplant, and I think this will be very helpful in future for starting my own practice. Thank you.
Dr. Jimon from Jalandhar. Coming to this conference was eye-opening. It was such an advanced technique of FUE under the guidance and expertise of Dr. Bhatti, which has taught us number of tricks and the practical tips which will make us take up this course under his guidance. Thank you.
I'm Rajiv Sharma, CEO of Medtech Incorporate, which is one of the largest suppliers of hair transplant equipment with a concerted focus on FUE. To be part of this conference was not only a wonderful experience, but I was really felt honored for being part of it and to meet so many doctors from faraway places, not only from India, but faraway countries like Kazakhstan also delegates were there. And I'll say not most of them, but everybody and all of them went satisfied, happy, and they think now they are better placed either to start their practice in FUE and they can do better now in the field of hair transplant. And for me personally also it was a rich experience. I have learned few more techniques how to go about in FUE, and this is going to do I think good for me as an individual. So as I can part with my knowledge whatever I have acquired in this conference to other surgeons and physicians who want to do FUE, but definitely it will also help me financially because I will be selling more and more to all of them. Thank you very much.
Dr. Girish, a consultant from Bangalore. This is the first time I was observing this FUE technique, and I learned almost A to Z, at least the theoretical part about the FUE. Sir has informed us in detail about the FUE techniques, and we could always some good drafts as well. And we are very thankful to him for organizing such an event which was so useful and informative to us. Thank you, sir.
Hello, I'm Dr. Paragno at Dr. Bhatti's Center for FUE Training Workshop. I'm very glad this is a technique which I think I can put into my practice right away, since I'm already doing the straight methods. And I'm very thankful for the FUECON which has happened this time, because I've come almost 2000 kilometers for this, and it has helped me greatly in my theoretical as well as I think it will be applicable in my private practice.
Good evening everyone, myself Priyanka Verma, the staff member in this center, the Darling Birds. Firstly, my dad had come in this center, they had to do this hair transplant, and then he said this hair transplant career is the best option. And even I just consult the Mandy ma'am, she just consult me about this hair transplant and even I was just thinking like this course is very difficult and it is a very technical line, and even I am just I like the technical most. So after that it's my about 1 month I just came here, and I just there were the 3 days workshop, and I just learned all the things, all the instruments, how the sir make slates, how the saline waters and the ringer lactates and all. I just learned all the instruments about that. Even the Rajiv sir had just learned all how to use these instruments and all. Even it's the best career, it's the best moment in my life. I just want to say thanks to Dr. Bhatti that he gave me a very good opportunity for joining this. Thank you.
Dr. Pradeep Kumari from Pune, and the conference was very nicely organized. The participation was good, and the participants were very happy with the hands-on experience given.
Hi, I'm Dr. Anvika from New Delhi. I think the conference was very interactive and very informative, and for the beginners it was an excellent conference. Thank you.
हेलो, मैं डॉक्टर नितिन जैन हूँ पूना से. मैं previously I am doing the FUT technique. Today we have attended the FUECON and we are influenced with the technique. So we have purchased the Harris system, and we are certainly going ahead with the FUE technique also. So मुझे लगता है कि for beginners and as well as for the new era or coming up demand from the patient, we should start up FUE so that we can deliver more to the patient. You can combine or you can also do independent technique of FUE. And as per FUECON, for the FUECON I can say that we have seen live demos, and as well as we have got hands-on experience, so it is very nice and very well organized conference. And certainly we are confident that we will do FUE in next couple of weeks only. That much easy, or that much means if you are a knowledgeable person with the hair anatomy and little bit of hair transplant, you can certainly jump into the hair transplant with the FUE technique. That's it, I can say. Okay, thank you.